Hello, I'm here to talk about the evolution of care, particularly in the age of digital virtual healthcare. My background is I'm a primary care physician of over 28 years, and I've worked through all of the different iterations of primary care. The traditional model of 30 patients per day, 8 to 5 care, taking call every third to fourth night, doing house calls. And as this evolved, we've seen different consumer-facing iteration of care in primary care. For a period of my career, I oversaw retail clinics when I was chief medical officer at Walgreens. And then today, this movement towards virtual health, both in a hybrid model where it's brick and mortar as well as virtual. And the latest iteration is total virtual care for primary care. What is the issue today? The US healthcare system is one of the last multi-trillion-dollar markets to be disrupted. We've seen disruption in retail, transportation, and financial services, but not so much in healthcare. Average American experience is not great in healthcare. They find it expensive, with 50% of families can't afford their deductibles, inaccessible. ER visits result in a overutilization of resources because folks cannot access a primary care. Families decide to postpone care because they can't afford it. And many areas of this country are primary care deserts. So what we've seen is the digitization in many segments of our economy. Healthcare is the last area to become digitized. There are significant secular tailwinds that is driving this. First, there's a rise in high deductible health plans. When you have a high deductible health plan, if you reach that level of $1,600 to $1,800 deductible, only 80% of folks with that high of a deductible actually use their insurance. So they're paying out of pocket. So they're looking for access to care, and they're very aware of what they're paying for. Then there's the consumer adoption of technology. Particularly in millennials, they are very favorable towards digitized care, where they can get care that's accessible, affordable, and price transparent. And then there's this rapid increase in medical costs that are driving this need for price transparency. If you look at all of the different markets in primary care, there are huge total addressable markets. For two of the areas that we started off with at HIMS and HERS, hair loss and ED, these are large markets. We recently got into anxiety and depression around behavioral health, and we've been doing dermatology since the inception of the company. We're looking at going into virtual primary care, and we've done about 60 conditions in primary care. And there are other areas that are more chronic conditions, such as diabetes and hypertension and hyperlipidemia, that are very amenable to virtual care. So when we look at what we do at our company, we really represent a significant market segment for millennials. 80% of our customers are first-time buyers. Millennials make up the majority of our customers, and 70% of the US population is Gen X or younger. So it's a large market. Think of us as a front door to healthcare for this demographic. Do millennials need this care? Absolutely. I would consider them at risk and underserved. 40% without intervention are going to have higher mortality and more significant chronic disease conditions. There's an accelerated decline in their health compared to Generation X. And if the most adverse projections take part, there's going to be an increased spend per capita per year of $4,500 because they're not caring for their chronic conditions. How do millennials prefer to get care? They prefer self-diagnosis. They will Google up a symptom or an issue, get information off the internet, and then try to access care directly. They don't normally go to a health system's website or look to establish with a primary care physician. In fact, 50% have no personal relationship with a primary care physician. 93% don't even schedule preventive physician visits. And 70% would rather have an online visit and also get their prescriptions sent to them as opposed to going to a traditional retail pharmacy. How do you engage millennials? First, you have to have access to care. You have to have very price transparent care, and you have to destigmatize conditions. And so as a company, we actually have an omni-channel marketing and communication. We use paid, search, Instagram, Facebook, blog, and we have a very robust life cycle retention program that as someone comes onto our platform and access care, we continue to outreach for them, ask them how are they doing? Are they having side effects? Is there anything more we can offer them? And we also have provocative messaging that triggers conversations around their healthcare. When we look at the areas that millennials are coming into access care, it can start with areas such as birth control, hair loss, anxiety, depression, primary care, dermatology, erectile dysfunction. But we see this evolving into other areas such as sleep, fertility, and chronic disease management for conditions such as diabetes and hypertension. So when we look at HIMS and HERS, we are really the first digitally native, fully verticalized, multi-condition health platform. We provide access to high quality, integrated care from start to finish. So we created a consumer brand. We developed a distributed provider network. These are physicians and providers who work part-time for us, follow evidence-based guidelines. We built an EMR around really accessible, high quality care, but also get rid of a lot of the fluff in the traditional EMRs. So the essential questions can be asked, answered, communicate with providers, get prescriptions if appropriate, and make it really a frictionless experience. So we have a digitally native telemedicine platform. And then if a prescription is needed, this gets sent to a cloud-based pharmacy. You don't have to go to your traditional retail pharmacy to pick up the prescriptions. They're actually sent to you. We hear that this is what the millennials want. They identify with that frictionless experience. So we're really fully verticalized telemedicine platform with a proprietary telemedicine stack, national provider work, over 300 providers, diverse product offerings, which we've really expanded over the past year, partially driven by the pandemic, and then that cloud-based pharmacy. So as a new front door to healthcare, we've created this really frictionless experience. It's fast and efficient, comprehensive and affordable. For a primary care visit, for example, it's $39. Ubiquitous access, 24 hours a day, 7 days a week, stigma-free. These are really comprehensive, but also very experiences that it's not associated with the stigma, and it's personalized for the customer who comes on our platform. So how does this work in a virtual health platform? First and foremost, you need to verify that in fact, the customer coming on the platform is who they represent themselves to be. So we have a multi-system tools that verify the identity of the customer. The consults are actually carried out by providers who follow evidence-based guidelines and algorithms. And the diagnosis is supported by these guidelines. And there's continuous outreach after a customer receives a visit. They may get a prescription. If they do get a prescription, or if they have ongoing problems, 24/7, they can access a provider to answer their questions. So it really enables a healthcare experience of the future. This is what consumers expect. You can have your visit off a mobile device. In fact, over 80% of our visits are done off mobile devices. You click on through our site, what issue are you here with today? For example, skincare. I have acne. You take a high resolution digital photo. That photo gets to the provider. The provider looks at the photo and goes through the questions that you've answered, and then offers customized medication solutions that are sent to the patient. It's a subscription model. So for the cost of $30 to $35 per month, they get unlimited provider visits, but they also get the prescription sent to them. That's included in that subscription price. A big change in our company over the past year has been the really fairly significant expansion in the scope of care. We started off with offering treatments and evaluation for sexual dysfunction like erectile dysfunction and premature ejaculation, hair loss, dermatology, particularly in the areas of aging and acne and oral contraceptives. But we've really expanded into primary care, offering over 30 episodic condition evaluation and treatment. We also folded in COVID-19 home screening through a saliva-based test run through Rutgers University. And then about 7 months ago, we launched behavioral health with a focus on anxiety and depression. All this is made possible by really evidence-based guidelines and comprehensive provider training. These are all board certified providers. They're all licensed in the states that they practice. We're in all 50 states today. Most of our visits are asynchronous. In some states, we're required to do synchronous visits, that is face-to-face. We have security audits. We verify the credentialing of all of our providers, and we provide comprehensive web-based training for every condition that our providers treat off our platform. We are actually able to grade providers on visits that they finish, and we actually grade them on 5 criteria, including website manner, how they interact with the patient, whether they're following evidence-based guidelines or not, whether they're prescribing the appropriate medication at the appropriate dose. Our average score for providers is a 95th percentile. If you fall below a 90 percentile, you actually get retrained. We've done over 30,000 encounter reviews today, and we have a network of over 300 providers in primary care, and then a smaller subset that specialize in behavioral health. Those are board certified psychiatrists and psychiatric nurse practitioners. The result of this is really a high value consumer experience with a high NPS score of 65. Our customers like the experience they receive because they're getting accessible, affordable care that's high quality. The other aspect that we've added into our clinical offering is our own cloud-based pharmacy. We have a 300,000 square foot Ohio pharmacy that is now rolling out state by state. So providers can prescribe through this pharmacy and the medication gets delivered directly to our customers. We see ourselves as part of the healthcare ecosystem. In some ways, we are a disruptor, but in other ways, we really want to be connected to traditional healthcare. We do this through relationships that we've developed with Mount Sinai in New York, Ochsner, and then most recently with a large managed service organization called Privia Health. And so in these relationships, we offer that 10 to 15% of patients that have high complexity and are not appropriate for virtual care, we offer them specialty referral, brick and mortar referrals into one of our partners. If they are not in an area of the country we have this partnership, then we, as much as possible, provide them with access and referrals into a brick and mortar location. We realize we cannot serve all of their needs in a virtual environment. So it's really a new age of healthcare. It's really the evolution of the primary care model that I began practicing years ago for over 30 years, and we've added in virtual care. The pandemic has actually accelerated some of this virtual care work, but what we saw even prior to the pandemic, this model was being embraced, particularly with the millennials, in terms of virtual care, cloud-based pharmacy, high quality, and price transparency. The pandemic has accelerated this, and we see this as continuing to grow because it is filling a need that is there for customers as they try to access healthcare in a new modality. Thank you.